Hi! Welcome to our video discussing a multidisciplinary approach in dentistry, specifically focusing on dentigerous cysts. Before we dive into our topic, let's first define what a dentigerous cyst. A dentigerous cyst is a benign fluid-filled sac that develops in the jaw or on the crown of an unerupted tooth, typically a canine or molar. It's one of the most common types of cysts in the jaw and arises from developmental issues during tooth formation. Causes are fluid buildup and abnormal accumulation of fluid around the developing tooth epithelium could initiate cyst formation. Development issues, disruptions during tooth development might play a role. Symptoms are swelling, pain, tooth displacement, gum inflammation, and difficulty in chewing. What to do? The treatment for a dentigerous cyst depends on its size, location, and the patient's age and the unerupted tooth's condition. Larger cysts, or those causing problems, are typically removed surgically, potentially including the tooth, for smaller cysts or when saving the tooth is desired. Marsupialization involves creating an opening to drain the fluid and shrink the cyst, sometimes followed by braces to erupt the tooth. Here's an example of case presentation with chief complaint and symptoms. Based on clinical radiographic assessments, the clinician diagnosis was a maxillary dentigerous cyst associated with an unerupted maxillary canine. This diagnosis was confirmed through histopathological examination. Treatment are marsupialization, orthodontic treatment, canine extraction, bone augmentation, implant placement, and final occlusion. This case highlights the importance of collaboration between different dental specialists. By working together, they can provide the most comprehensive and successful treatment plan for the patient. Dentigerous cysts are common odontogenic cysts, typically associated with unerupted teeth, often found near the mandibular third molar or maxillary canine. Marsupialization is a surgical procedure used to reduce cystic pressure and promote tooth eruption, often followed by orthodontic traction. Factors affecting tooth eruption post-marsupialization remain debated, including patient age, tooth depth, and inclination. In cases where orthodontic traction fails, implant placement after marsupialization and bone grafting may be considered. However, the literature on this procedure is limited. Rehabilitation. In the presented case of an 18-year-old patient, a multidisciplinary approach was employed, utilizing autogenous bone grafting to augment bone formation for successful implant placement. Following marsupialization, careful consideration of patient factors and lesion characteristics is essential for optimal treatment outcomes when treating a dentigerous cyst involving an unerupted tooth. A multidisciplinary approach is necessary from beginning to end to achieve and establish proper occlusion. The present case demonstrates how multiple procedures such as surgery, orthodontic treatment, and implant placement led to a satisfactory outcome for the patient in terms of aesthetics and occlusion. Occasionally, a timely switch of treatment plan and multidisciplinary treatment are needed to solve problems that may arise. Clinicians must work together with the surgeon, orthodontist, and implantologist to choose the best treatment for the patient. Here involves collaboration and integration of knowledge, methods, and perspectives from multiple disciplines to address complex problems or achieve common goals. First, we have the oral surgeon, responsible for the surgical removal of the cysts. Second, we have orthodontist, to preserve the unerupted canine and encourage its eruption. An orthodontist would be involved. And lastly, prosthodontics might be needed later in the treatment plan depending on the outcome. For complex dentigerous cysts, a team approach is crucial. It tackles all patient concerns, leverages specialist expertise for optimal diagnosis and adaptable treatment, and improves aesthetics. While minimizing risks, this collaboration fosters knowledge exchange, ultimately benefiting both patients and the field of dentistry. Here are the references. That's all. Thank you for watching. Submitted by Dulce Patricia Rong and Trisha Blessy Dundig.